myself such time as I may consume.
Gentleman's recognized.
Millions of Americans are finding the security and the peace of mind that comes from having access to a family physician through the Affordable Care Act. And if the gentleman has been listening to the American people, he's turned a 10 ear to the 16 million Americans that have now enrolled in the marketplaces under the Affordable Care Act. Republicans unwilling to accept the success of what they demeaned as Obamacare, Republicans who failed more than 60 times in this House to repeal Obamacare, who failed 3 times in the Supreme Court to undermine Obamacare, have now embarked on a new strategy, which is to circumvent and undermine the invaluable protections of the Affordable Care Act. With this bill, Republicans are demanding that every individual who gets stuck in one of these newfangled plans that they have is denied protection from having their insurer exclude pre-existing conditions, no assurance of coverage for essential medical care, and no assurance of affordability. I offered an amendment to correct one part of this defective bill to give Americans statutory protection so they're not back in the old pre-Affordable Care Act period of losing coverage when they needed it most because they had something the insurance company defined as a pre-existing condition. But that was rejected. At the time, they claimed that was their intent. But when you look at the specific statutory language, there is no doubt that the protection for pre-existing conditions and essential conditions is excluded from their legislation. These so-called individual coverage health reimbursement arrangements, or ICHRAs, are about as convoluted as the name suggests. They are, as my grandson's Canyon would say, they're icky. Handing people a voucher and telling them to go shop for coverage follows the same ill-conceived Republican approach to sabotage Medicare, which they continue to promote in their latest budget. Instead of giving Medicare beneficiaries guaranteed coverage, they would give seniors a voucher with declining value and tell them to go find coverage. Instead of the guaranteed comprehensive coverage workers now receive, this bill would force so many people to find health care in a sea of junk, exposing them to misleading marketing and aggressive brokers. An estimated 2 million workers would be immediately impacted by this sorry bill, and with another provision that is in the bill that directs the Treasury Department to go out and promote access to junk plans, we could expect these numbers of impacted workers to increase. Inevitably, the result is bare bones junk insurance that misleads on coverage, has high out-of-pocket costs, and abandons those with pre-existing conditions. The policy's fine print takes away all the bold promises of the marketing.
This is breaking news. The Biden administration has just made a big announcement regarding Medicare prescription prices and requirements. Over 15 million Americans are expected to be removed from Medicaid very soon. States are also now pushing for work requirements that residents will have to meet in order to be eligible for Medicare coverage. My dear friends, please make sure that you watch until the end of this video for the complete details. Also, this coming Friday, I will be announcing more winners for the Walmart gift card giveaway. If you'd like to enter the weekly giveaway, friends, all you have to do is click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you watch and then comment on, friends, the greater your chances of winning the weekly giveaways. This spring, there was a massive shift in healthcare coverage, potentially the biggest since the country implemented the Affordable Care Act 10 years ago. A few months ago, when the country officially moved out of the national emergency phase, states have been given additional federal funding for the last 3 years to provide continuous Medicaid coverage, ensuring no one lost health care amid the throes of the crisis. The end of the emergency this past May also meant the end of the federal money, and states could once again begin reviewing their Medicaid rules, asking people to renew their coverage and prove that they're still eligible for government-funded health care. Florida began redetermining Medicaid eligibility on May 1st, 2023, and will be updating the coverage rules each month through March 2024. In Arkansas, at least 110,000 Americans have lost coverage so far. Governor Sarah Huckabee has called the Medicaid rollbacks necessary to help get the program back to normal. Nearly all states will have begun their redetermination process by July, and about half the country already has. The United States Centers for Medicare and Medicaid Services says that 15 million people may get removed from the Medicaid rules during this process. The estimate comes from the historical data, which shows that before the crisis, people struggled to keep up with regular reapplications for Medicaid coverage. Procedural errors, missed notices, and confusion are known factors in part to blame for eligible recipients losing their coverage. For example, in Florida, 82% of those removed from the Medicaid rolls in May lost coverage because of procedural reasons. That means that people didn't fill out a form correctly or submit it in time, or perhaps they moved from homes and missed a letter notifying them of the change in the mail. But some officials in the state of Minnesota are moving the first deadline for eligible medical assistance recipients, giving 35,000 residents more time to complete and submit the renewal paperwork to maintain their coverage. The extension to August 1st provides extra time for households to take proper action to avoid any gaps in their health care coverage. However, in the state of Georgia, there is a different push. Georgia's limited expansion to Medicaid launches this week, making Georgia the first in the country to tie work requirements to some Medicaid benefits. The program, which is called Pathways to Coverage, was first passed by the Georgia General Assembly in 2019, but faced a battle in the courts to enact it after President Biden took office. The Georgia plan expands coverage to all adults who earn up to 100% of the poverty line. This means any single individual who earns $14,580 per year or less, or a family of four whose household income is less than $30,000 a year, will be able to get qualified for coverage. Georgia Pathways is expected to cover about 64,000 residents of Georgia. This coverage is only an option for those beneficiaries if the adults show they are working, volunteering, studying, or in vocational rehabilitation for 80 hours each month. Undeterred by a growing number of lawsuits, the Biden administration released revised guidance for Medicare's new prescription price negotiation program. The latest guidance outlines how the Centers for Medicare and Medicaid Services will negotiate with prescription makers to reach an agreement on a maximum fair price for selected medicine. The program was first authorized by the Inflation Reduction Act that congressional Democrats passed last year. The Biden administration intends to keep its timeline of announcing the first 10 prescriptions that will be selected for negotiations by September 1st. They will negotiate during 2023 and 2024. Then the prices will be effective starting in 2026. According to CNN News, if prescription makers do not comply with the process, they will have to pay an excise tax of up to 95% of the medication's U.S. sales, or pull all their prescriptions from the Medicare and Medicaid markets. Well, my magnificent and most marvelous friends, that is the end of my daily stimulus update video for this Sunday. My dear friends, thank you so very, very much for being here and for being part of this community. To say thank you, I will be announcing more winners every Friday for the Walmart gift card giveaway. Please make sure that you enter the giveaway by clicking and liking several of my videos, and then comment below the keyword of each video that you watch. The more videos that you watch and then comment on, friends, the greater your chances of winning the giveaways. Thank you and have a wonderful, safe, and blessed weekend.